Hi, I'm Dr. Gregory Hartledge with Tallahassee Memorial HealthCare. I received my medical training at the University of South Florida and Emory University Medical Center and have been treating people with cardiovascular disease for the past 10 years. This program was created to help you understand your heart attack and treatment procedures and medications. Millions of people worldwide have heart attacks each year. The video you are about to see will help you understand what happened inside your arteries and to your heart that caused the heart attack and the treatment and procedures that you may have had afterwards. You can learn more detailed information about the procedures mentioned in this video by choosing the coronary balloon angioplasty video or the coronary artery bypass graft CABG video from the main program menu. If there's any information you need repeated, you can watch the video as many times as you wish. Please share this program with family and friends so they can better understand your heart attack and provide you with support. Let's start by learning how the arteries and heart function.
If you have recently been treated for a heart attack, a condition caused by a blockage of blood flow to your heart muscle, this video will help you understand the condition and its treatment. Your heart is a muscular organ that pumps blood containing the oxygen and nutrients your body needs. The main pumping chamber of your heart is the left ventricle. When your left ventricle contracts, it sends oxygen-rich blood to your body through a large artery called the aorta. Connected to your aorta are small arteries called coronary arteries. Blood flows from your aorta through the coronary arteries to supply your heart muscle with oxygen and nutrients. During your heart attack, blood flow through one of your coronary arteries may have been severely reduced or completely blocked. Your reduced blood flow may have been caused by a buildup of a fatty substance called plaque in your coronary arteries. If this plaque became disrupted, a blood clot might form and severely worsen the narrowing, or lead to a sudden, complete blockage, stopping blood flow down the artery. A blockage in your coronary arteries prevented the oxygen and nutrients in your blood from reaching the part of your heart supplied by the artery. As a result, heart muscle in that area started to die. Damage to part of your heart muscle is called a heart attack. It's also known as a myocardial infarction, or MI. Your heart doctor may have recommended a procedure to help open the blockage and improve blood flow to the damaged area. The procedure you had may have been a coronary angioplasty. During a coronary angioplasty, a balloon-tipped catheter inflates inside your blocked coronary artery to open it. The procedure may have involved placing a stent to help prop the artery open. This is usually a thin metal mesh that acts as a scaffold. Or you may have had a coronary artery bypass graft, or CABG. CABG is a surgical procedure in which the blocked areas of the coronary arteries are bypassed with veins or other arteries from the body. Before you left the hospital, your healthcare provider most likely prescribed several medications. Your medication may include the following: oral antiplatelet therapy helps prevent platelets from sticking together and forming new blood clots. You may have also received drugs called beta blockers that help lower your heart rate and blood pressure. Drugs such as angiotensin-converting enzyme, or ACE inhibitors, angiotensin receptor blockers, or ARBs, and calcium channel blockers also work to lower your blood pressure if needed. And you may have been prescribed statins, along with a low-fat diet, to lower your cholesterol. These drugs work by reducing the amount of cholesterol made in your liver. It is important to stay on your medications as your physician prescribed, even if you are feeling better. Do not go off your medication unless the healthcare professional that prescribed them tells you to.
Thank you for watching this video. I hope you found the information about your cardiovascular disease and heart attack helpful. If there's anything you would like to see again, you can simply visit the main menu and replay any video. We encourage you to share your feelings and questions honestly with us. Communication is an important part of our relationship. It will help us better manage your treatment and overall health.
Hello, I'm Dr. David Saint. I'm a cardiac surgeon with Tallahassee Memorial HealthCare. I went to medical school at the University of Alabama and received my cardiac surgery training at the University of Michigan. I've been treating patients with cardiovascular disease for the past 27 years in the Tallahassee area. This program was created to help you understand how and why coronary artery bypass grafting, or CABG, is performed. The video you're about to see will help you understand the steps of a coronary artery bypass graft, or CABG procedure, 3 different types of bypass surgery, and what you may expect before and after your procedure. If there's any information you need repeated, you can watch the video as many times as you wish. Please share this program with family and friends so they can better understand your coronary artery bypass graft, or CABG procedure, and provide you with support. Let's start by learning how the CABG procedure creates a new path for oxygen-rich blood to flow to the heart muscle.
If you or someone you know has recently had a coronary artery bypass graft, or CABG, this video will help you understand the steps of the procedure and how it restores blood flow to your heart. A coronary artery bypass graft, or CABG, is performed to improve circulation to the heart muscle. In this procedure, a healthy artery or vein from another part of the body is connected or grafted to the blocked coronary artery. The grafted artery or vein bypasses the blocked portion of the coronary artery, carrying oxygen-rich blood to the heart muscle. 1 or more coronary arteries may be bypassed during a single operation. Before the surgery, an intravenous line will be started, and you may be given a medication to help you relax. CABG procedures are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be inserted through your mouth and into your throat to help you breathe. A catheter will be placed in your bladder to drain your urine. Coronary artery bypass surgery generally takes 3 to 6 hours. During a conventional bypass surgery, your surgeon begins by making an incision in the skin over your breastbone or sternum. He or she will then cut the sternum and move your rib cage in order to get to your heart. Throughout the procedure, your circulatory system may be connected to a cardiopulmonary bypass pump or heart-lung machine. This machine may temporarily perform the functions of your heart and lungs during the surgery, allowing your heart to be stopped if desired, while the surgeon sews the grafts into place. Different blood vessels may typically be used for the grafts: the internal thoracic arteries in the chest, or the saphenous veins in the legs. For the internal thoracic artery graft, your surgeon will leave the upper end attached to the subclavian artery and divert the lower end from your chest wall to your coronary artery just beyond the blockage. Your surgeon will then sew the graft into place. For the saphenous vein graft, your surgeon will suture one end to the aorta and the other end to the narrowed artery just beyond the blockage. With the graft securely in place, your surgeon may use electrical signals to restore the heartbeat and attach a temporary pacemaker to the heart. Once your heart is again beating normally, if the surgeon used the heart-lung machine, it would be disconnected. Your surgeon will wire the breastbone back together and suture the skin incision closed. A temporary drainage tube will be placed through the skin beneath the incision. When the surgeon chooses to do the surgery without using the heart-lung machine, the heart continues to beat. This may be referred to as off-pump bypass surgery or minimally invasive surgery. Instead, a mechanical device is used to steady the part of the heart where grafting is being done. Surgeons perform minimally invasive bypass procedures using specially designed instruments inserted through small incisions or ports in the chest. After surgery, you will be taken to the intensive care unit. The activity of your heart will be carefully monitored. If necessary, the pacing wires will be used to temporarily control your heart rate. The chest tube will remain in place to drain excess blood and air from the chest cavity. Once you can breathe on your own, your breathing tube will be removed and replaced with an oxygen mask. The bladder catheter will remain in place. As you recover from surgery over the next 3 to 5 days, all of these devices will be gradually removed. Upon discharge from your procedure, be sure to contact your doctor if you have any questions or experience any side effects from the medications you are taking.
Thank you for watching this program. I hope you found the information about your coronary artery bypass graft helpful. If there's anything you'd like to see again, you can simply visit the main menu and replay any video. We encourage you to share your feelings and questions honestly with us. Communication is an important part of our relationship. It will help us to better manage your treatment and overall health.
Hi, I'm Dr. William Dixon with Tallahassee Memorial HealthCare. I received my medical training at Duke University Medical Center and have been treating people with cardiovascular disease for the past 20 years. This program was created to help you understand how and why a coronary angioplasty, sometimes called balloon angioplasty, is performed. The video you're about to see will help you understand the steps of a coronary angioplasty and how this procedure is designed to help restore the flow of blood through your coronary arteries. You will also learn what you may expect before and after your angioplasty procedure. If there is any information you need repeated, you can watch the video as many times as you wish. Please share this program with family and friends so they can better understand your coronary angioplasty procedure and provide you with support. Let's start by learning how this procedure works to expand your artery and improve blood flow.
If you or someone you know has recently had a coronary angioplasty procedure, this video will help you understand the steps of the procedure and how it restores blood flow to your heart. Coronary angioplasty, also called percutaneous transluminal coronary angioplasty or balloon angioplasty, is a procedure performed on blood vessels called coronary arteries that supply your heart muscle with oxygen. This procedure is designed to restore blood flow through coronary arteries that are narrowed or clogged by a buildup of a fatty substance called plaque. At the hospital, your healthcare team will explain the treatment and get your informed consent. Then, an intravenous line will be started. You will be placed on a heart monitor, and you will be given a sedative to help you relax. Most coronary angioplasty procedures last between 30 minutes and 3 hours. Depending on whether the angioplasty is done through an arm or leg artery, the doctor will numb the skin in your groin or wrist area. Then a needle will be inserted through your skin and into your artery. Once the needle is placed, a flexible guide wire will be passed through the needle into your artery. The needle will be withdrawn and exchanged for a small flexible tube called a sheath, permitting access to your artery. You may feel pressure when the doctor inserts the sheath through the skin into your body, but you will not feel the movement inside your artery. Next, the guide wire will be advanced up to your heart. A flexible tube, called a catheter, will be advanced over the guide wire and brought into position near your coronary arteries. The procedure will be monitored using an X-ray imaging device called a fluoroscope. At this point, your doctor will remove the guide wire, position the tip of the catheter just inside the coronary artery to be treated, and inject a special dye. The dye allows the fluoroscope to see inside your coronary arteries and take X-ray images called angiograms. Any blockages will be clearly identified as the arteries fill with the dye. Once the blockage is identified, your doctor will insert a flexible guide wire into the artery. A balloon-tipped catheter, called an angioplasty balloon, will be advanced over this wire and into position at the site of the blockage. Inflation of the balloon expands the narrowing and improves the blood flow. You may feel some chest discomfort while this is happening. Afterwards, your doctor will withdraw the deflated balloon from your artery, leaving the guide wire across the treated area. Often, a small tube called a stent that looks like a wire mesh will be placed in the treated area, acting like a scaffold to help prevent the artery from closing back in. A properly sized stent, chosen by your cardiologist, that is compressed on the balloon, is advanced into the artery over the same guide wire. When the balloon is inflated, the stent will expand and lock into place. After the balloon catheter is withdrawn, the stent will remain behind to hold the artery open. After your procedure, a bandage will be applied over the artery that the doctor used to get up to your heart. You may be asked to lie on your back for several hours, during which time you will be checked periodically for any signs of bleeding or chest pain. You may be discharged home on the same day or after an overnight stay in the hospital.
Thank you for watching this program. I hope you found the information about your coronary angioplasty helpful. If there is anything you would like to see again, you can simply visit the main menu and replay any video. We encourage you to share your feelings and questions honestly with our heart and vascular team. Communication is an important part of our relationship. It will help us better manage your treatment and overall health.
Each year, millions of people worldwide have heart attacks. Many people live full and active lives after their heart attacks. In this video, we are going to discuss tips for a healthy lifestyle and ways to work with your healthcare team to help build a strong foundation for better health. After a heart attack, life can be challenging and may cause a variety of emotions. You may feel overwhelmed by the amount of information you are learning, but you are not alone. By empowering yourself with knowledge and working with your healthcare team, you may feel better prepared to manage life after a heart attack. Building and maintaining a strong and open relationship with your healthcare team may also help you feel confident and knowledgeable about your treatment plan, able to talk about your cardiovascular disease and its symptoms, and address any symptoms sooner rather than later. There are a number of steps you can take. The first step is to learn about all aspects of your treatment plan. Before each visit to your doctor, you might want to prepare a list of questions to ask, and then, during your visit, write down the answers he or she tells you. You may find it helpful to bring a trusted friend or family member along to provide support during your visits with your doctor. If you smoke, the first thing your doctor or nurse may talk to you about is quitting smoking. Quitting may lower your chance of getting cardiovascular disease or having another heart attack. Smoking is a major risk factor for cardiovascular disease, heart attack, and stroke, especially when combined with other risk factors such as high cholesterol, high blood pressure, and being overweight. Talk with your healthcare team about ways to quit smoking. They may suggest a program or product that can help you. Getting exercise can help keep your heart healthy. Your doctor or nurse may suggest an exercise program that is safe for you. The American Heart Association recommends adults get 30 minutes of moderate activity daily. You can work your way up to 30 minutes by breaking up your exercise into shorter 10 or 15-minute sessions. A daily walk, bike ride, or swim is an easy way to get started with a moderate activity. You may enjoy some company while you exercise. Invite a friend and keep each other motivated. As with any new activity or exercise program, be sure to discuss it with your doctor before you begin. A healthy diet can be an important part of your strong foundation for better health. Fruits, vegetables, and foods with fiber can help prevent cardiovascular disease and stroke. Avoiding foods with trans fats, such as fast food, and saturated fats, like red meats and many cheeses, can help keep your cardiovascular disease from worsening. Here are some basic tips to help you eat a healthy diet. Eat more fruits and vegetables. Fruits and vegetables are good sources of vitamins and minerals and contain substances that may help prevent cardiovascular disease. All produce counts, which means canned, dried, fresh, and frozen varieties can help you reach the American Heart Association's recommended 4 to 5 servings a day. Select whole grains. Whole grains are good sources of fiber and other nutrients that play a role in regulating blood pressure and heart health. Try adding things like whole wheat or whole grain bread, brown rice, or whole grain cereals to your diet. Opt for vegetable oils. Limit the fat you use in cooking. Consider replacing any solid fats like butter with liquid vegetable oils such as olive, canola, corn, or safflower. Choose skinless chicken, fish, or beans for protein. These protein foods generally have less saturated fat and cholesterol than meats such as beef, pork, and lamb. Reading food labels may help you make healthier food choices. Use the information you find on food labels to help you make healthy choices about everything from sodium to saturated fat content. Changes to your diet and exercise plans may help you begin to feel better, but it's also a good idea for your overall health to learn to manage stress. Too much stress can leave you feeling tired, cranky, and forgetful. You may worry about having another heart attack. Talk with your doctor or members of your healthcare team about how you feel. Stress is a part of life, but good stress management skills can help you cope with stress in a healthy way. Try to stay positive and set some achievable goals for yourself. Learn to accept things you may not be able to change. You may find family and friends great resources for talking about your feelings or just sharing things that make you laugh. Remember to get a good night's sleep. Most of us need 6 to 8 hours of sleep to feel rested. If you feel stress is keeping you up, find ways to work on it and talk with your doctor. Plan your days to include exercise and time enough to tackle tasks. This may help you get things done at a comfortable pace that doesn't add stress. Consider planning and shopping ahead for meals so you can make heart-healthy choices at the grocery store and eat well. Thank you for watching. We hope you find this information helpful. Living with cardiovascular disease can be a challenge, and we're glad to be able to provide you with some support.